Clitoris to anus, that is our most valuable real estate in our body. That is important to take care of that better than we take care of our wrinkles, all this stuff. We need to take care of our vulvar area, clitoris to anus. It really does affect us long-term, affects our quality of life, and that's what's really important. That pain, that discomfort can be from dryness, irritation, the loss of elasticity, the loss of lubrication. And so all of these things are affected, and that is part of natural aging, but that's where we want to intervene and reverse that process. And it's not only about the reproductive hormones, about other major hormones. And the three that I talk about in both my books, The Hormone Fix and Keto Green 16, are cortisol, insulin, and our most powerful hormone of our body, oxytocin. The transitions that women go through, either it's monthly or from when we start our periods to when we end our periods, it is natural. I always say it's natural and mandatory. Suffering is optional.
You're listening to Cleanse, Heal, Ignite podcast, and I'm your hostess, Diane Kaiser, functional diagnostic nutrition practitioner, former pro soccer player, transformational leader, holistic healer, and life purpose coach, helping you and your business awaken to your full potential. We are a transformation tribe of visionaries empowering passion-quenching, heart-centered advice to wellness warrior leaders on self-love, nutrition, mindset, and divorcing perfectionism. Our mission is to help you laugh your way to a sexy belly, love your way to vitality, and live your life with purpose by sharing real talk and truth drops that will help you cleanse your body, heal your hormones, and ignite your life. Side effects of this podcast may include all-day energy, happy hormones, perfect poops, increased confidence, becoming your own best healer, and catching the self-love virus. There's currently no vaccination to protect you from this and no known cure. In most cases, listeners experience a strong desire to accept new challenges, ditch toxic people, follow their heart, and dance like no one's watching. If you experience moods happier than usual, live it unapologetically and share with your social media friends immediately. Okay, warrior, this is a power episode. And we're going to talk about hormones. We're going to talk about yeast infections, urinary tract infections, testosterone for men and for women, how to use bioidentical hormones, whether or not birth control makes sense for you. If you did use birth control, antibiotics for UTIs, what the danger is in that, and more. We're going to talk a lot. We're going to talk about, as Dr. Anna says, the most important real estate in your body, from the clitoris to the anus, and why that's really important. We're even going to talk about how addressing these areas of your body is going to possibly save you a lot of money down the road and not having to spend money in long-term care facilities, because incontinence is a major issue. So you're going to learn so much in here. It's powerhouse action step. Dr. Anna Cabeca is one of my personal and dearest friends. She is an internationally acclaimed menopause and sexual health expert. She's a global speaker and pioneering promoter of women's health. So she has several different mechanisms that she supports her patients with. And today on this episode, she's going to share many different things that she can help you with without having to go to see an OBGYN, because she actually helps to support hormone metabolism and the mucosa of all of your tissues, the pH of your body, and how to reverse weight gain, energy drain, body pain, and broken brain. So you have many OBGYNs that you've seen that give you bioidentical hormones or birth control or IUDs or different things to support your hormone production synthetically, but very few will actually talk to you about lifestyle, about diet, about the mental, emotional, spiritual, and the importance of reducing stress and everything in between. So I'm stoked to have her today. Let's dive into the episode. And this is possibly going to be one of the episodes you're going to want to take notes, and be sure that you visit all the links, check out all of her products, because they are an absolute goddess send. Here we go.
Oh, and one more thing I forgot to mention. Dr. Anna Cabeca wanted me to pass on the good word to you that she wanted to give you a gift. And it is this cream that she created called Julva. She wants to give you a free sample size that she could have shipped directly to your home. The reason why I like Julva so much is that it does have a small amount of bioidentical hormones, and it helps a lot of women with urinary issues, vagina issues, inflammation. If you have any issues with your parts and you really want to enliven them once again and reduce pain that you may experience as you age, or just because of you're stressed and you feel like you're just run down, this is the cream for you. It is a free gift. Just go to my website, Cleanse, Heal, Ignite, and click onto the podcast with Dr. Anna Cabeca, and the link will be in there for you to get it for very free. So let's talk about your beautiful, delicate parts with your girlfriend, Dr. Anna Cabeca.
Hey, beautiful warriors. Welcome back to another episode of the Cleanse, Heal, Ignite podcast. Today, we are going to talk about one of the most important topics among female health, which is the vagina, hormones, yeast infections, urinary tract infections, weight loss, energy gain, body pain, weight gain, and energy drain. All the things that you are wondering, is this really what life is supposed to be as a woman? Is this what's really supposed to happen as I age, if I stress? And the answer is no. The answer is no. The answer is that no symptom or any suffering is normal. That is actually a huge wake-up call, a scream, a whisper, that your body is trying to get your attention, that something is not right. And I brought on one of my dearest friends, Dr. Anna Cabeca. She is the girlfriend doctor. So these topics can be really, really heavy. And so we're going to make it casual and as fun as we could make it to talk about some of these topics that have a lot of stigma. So I don't want you to think that you need to suffer, and neither does Dr. Anna Cabeca. So let's jump right into it. Dr. Anna, thanks so much for being here today with us.
It is a pleasure to be here with you, Diane. Thank you so much.
Yeah. So
I was just thinking, as you're going through this and we're talking about all these symptoms that are coming up, right? Like urinary tract infections, hot flashes, night sweats, weight gain, energy drain, all these things, right? Mm-hmm. And it's like, oh my gosh, here you look forward to menopause. Like, I'm not going to have a period anymore. And then you're like, whoa, wait, give me my period back. If it gets that bad, right? And so it was kind of just laughing as you were talking about that, thinking, yeah, the transitions that women go through, either it's monthly or from when we start our periods to when we end our periods, it is natural. I always say it's natural and mandatory. Suffering is optional.
Yeah, right. Suffering is optional, and suffering is like literally someone calling you on your phone going, hey, we got to do something about this, like alert, alert. And the issue is that we are not taught to how to listen to our body. We're not taught who to go to that could help us decode what these whispers or screams can be. And like the biggest scream is cancer, obviously. Mm-hmm. So if it gets to that, that means your body's been suffering for a long time, or other issues too. But along the journey of maturing as a woman, there should be no suffering. So let's talk about hormones first, Anna, and just let's get them first, the root, the foundation, because the logo for my company is a tree, and it's called Chi. It's called the Chi of life. And so what I love to talk about is the roots, is that if you want to sweeten the fruits, then you must address the roots. So the roots in this case, especially for what it is defined as what it means to be a woman and how to thrive instead of just survive as a woman, is hormones and our hormone balance. So let's talk about the lowdown on hormones. Like, what are they? How do they influence our health? And how do they change as we age?
These are great questions. And it really is. Hormones are fascinating because they're energetic molecules, right? And we have energetic bodies. So we have just begun to really understand them. I feel like understanding hormones is still in its infancy, as advanced as we sometimes want to believe we are, right? Hormones are energetic molecules. So that's often why when you go to your doctor and say, I would like you to test my hormones, they're like, oh, I don't know what, really, how or what that's going to measure, because there's so much conflicting information, because there's so much swinging. We've got a gestalt. We have optimal levels, but look, hormone levels in our blood, our saliva, and our urine all differ, and they can differ at the same time, but they give us another picture, another angle. So like if you're looking at a cube, they give us one side of the cube. And so each one, so you kind of have to look at hormones in different ways. And when we talk about hormones, we talk about these energetic or chemical messengers in our bodies that are, transferring information from one area to another to put a process in place. And I like to think of hormones, especially as a gynecologist. I always want to talk about progesterone, or mother hormone, progestation, pro-life hormone. Talk about progesterone, and then, estrogen and testosterone, these reproductive sexy hormones that give us our femininity and our sex drive and, shapeliness, and then DHEA, this super boosting adrenal prohormone. And then, but really, and this is what I've learned from my decades as a gynecologist and obstetrician, it's not only about the reproductive hormones, about other major hormones. And the three that I talk about in both my books, The Hormone Fix and Keto Green 16, are cortisol, insulin, and our most powerful hormone of our body, oxytocin.
Yeah.
The love and bonding hormone. I know you love this hormone. It's a favorite. And so, And as our body, as we cycle monthly, as we go through monthly cycles, our hormones shift. As we go through our life cycle, our hormones shift. We have peak levels of hormones in our reproductive years. In our late 20s, DHEA, our adrenal hormone, no kidding, because it's also, depleted in times of stress. So stressful times of our life, like mid 20s to now. But our DHEA starts to deplete this hormone, and progesterone in our mid 30s, and then estrogen and testosterone following suit. But a steep decline in progesterone because our ovaries kind of like, the time clock kind of, it clicks off, and there's a rapid drop in progesterone as we decrease our ovarian function over time. And so we have this shift, and we get into this period of transition during this time that can feel, if we're not balanced, if we haven't optimized these other three major hormones, then we can feel really, really crappy. And that's the fatigue, the anxiety, the mood swings, the irregular menstrual cycles, frequent urination, urinary tract infections, vaginal discharges, breakthrough bleeding, ovarian cysts, symptomatic fibroids, breast cysts, breast tenderness, and then all the neurologic symptoms like the anxiety, depression, insomnia. So it's a neuroendocrine combination. It's affect our nervous system, our reproductive hormones. It's all tied in together. And that's why I'm so passionate about, reestablishing a hormonal balance as naturally as possible, because then our body kind of just floats in through the transition. Much better, much better.
Yeah. And this is an issue where so many women go to seek counsel from a standard OB, and they get recommended some kind of a birth control or progesterone, or what is it called? What is it? Oh, Premarin, or
right, our synthetic bioidentical hormones. And you're right. I actually was speaking with a very educated woman recently, and at mid 40s, and it just blew my mind that she was, mid to late 40s. She done childbearing years, but on birth control for her menopausal symptoms. And I said, whoa, because that's number one, we want our ovarian communication with our rest of our nervous system, neuroendocrine, right? We got to keep these communication pathways open. So when we're using birth control pills, we're using, pregnancy level hormones, and we're also using a synthetic progestin that can have negative cardiovascular effect at a time in our life where we're most vulnerable, becoming more vulnerable for cardiac issues. Mm-hmm. So I found that to be really shocking. And so it's so important to educate. There's time where the pill's the best option, mm-hmm. right? And there's time where it's really not. And I would say to manage perimenopausal symptoms, very rarely, less than 1% of my clients did I feel even a short-term stint on birth control pills was the best option, because we can manage it with bioidentical hormones, with detoxification, right? Modified elimination diet and my keto green diet, all of these things, natural bioidentical progesterone, again, to clarify, bioidentical progesterone, not synthetic. We don't want synthetic hormones, just like we don't want synthetic food. Mm-hmm. Synthetic hormones are no better.
Or synthetic people, or synthetic toxic beauty, which is what I talk about so much, synthetic beauty versus natural beauty. And really, this whole conversation about hormones is one of the key main things and drivers for our natural beauty, and to illuminate our key features that we want to highlight instead of cover up and deceive with. So speaking to hormones, I mean, there's a lot of women who are doing, IUDs, birth control, and Depo-Provera. I did all of those myself. And so Depo-Provera is a synthetic version of progesterone. If I came to you and said, hey, Dr. Anna, I've done all of these things and I'm struggling with my hormones still, what would be some of the things that you may have said to me 10 years ago before I got on those things that could be solutions that I could be using now? And so what I'm trying to do is help women who might be considering, oh, I'm on all of these synthetic hormones, or I'm having problems and I'm wondering if I should do synthetic or if I should do natural.
Yeah, and this is where if we need birth control for birth control, we want to look at the best and safest and most effective
Mm-hmm.
form of birth control. So that's where I typically go to the Paragard IUD or the male vasectomy.
Mm-hmm. Mm-hmm.
So the Paragard IUD, I've used that in so many clients over the years. I've recommended it to all ages, and as well, I used it myself during my in between children. And until recently, I think I finally had it removed after like 12 years. Don't tell my doctor. Oh, that's me. Okay. So, it is, the Paragard IUD or copper T IUD is a non-hormonal IUD that's 99.99% effective. So it's very effective. The issue with it is that it can increase cramping, but if we're working with natural, natural antioxidants, omega-3s, a low inflammatory diet, that typically we're able to get that under control. And maybe it's just two Aleve at the start of your period. But, and that should take care of any, cramping that you can have, but we really will work on that. The other is the Skylar IUD, which is a lower dose Mirena IUD. And again, we want it affecting, we want it to affect the uterus so that the sperm and egg don't meet. That's the goal, to create an inhospitable environment for fertilization to take place. And that's it, right? We don't want to shut down ovarian function completely, which is predominantly what we do with birth control pills and many of the other many other options. But so that's a really nice way to use an IUD. Now they're completely reversible versus something if you want permanent birth control, thinking about tubal ligation or so there are those options. And again, I mentioned vasectomy. It's a very good option as well. So I think during this time when you're looking for birth control, it's also knowing your body's rhythm too. I think that's really important. And we underestimate the power of knowing your body's rhythm because we are unpredictable. I mean, how well do we keep to our New Year's resolutions? So keeping to a time, like avoiding sex when your body's like, this is the time I want to have sex because I'm fertile. I mean, it's challenging. And, so rhythm methods are very, very challenging. So I prefer the non-hormonal IUD and birth control pills when needed, but the lowest effective dose. And you have to be really good about taking a pill every day. And I never was. There are also patches and intravaginal, like the NuvaRing that was available. So different forms that have come available.
What about the Kaya diaphragm?
I haven't had experience with that.
Okay.
Again, that's one of those things that, again, you have to be sure you use it correctly and use it every time. So that's it. And then that with timing is, I mean, it's an option. Cervical cap. Yeah.
There's a lot of options for birth control. And I wish I would have known about these, well, they weren't really around, but I wish I would have known about the side effects for birth control pills back then. And then Depo-Provera, that's another one. I didn't have a period for 8 years. And I know a lot of women who struggle because I was on Depo-Provera that whole time and I didn't have one. And I thought, oh, this is wonderful. Kind of like what women look forward to with menopause. I don't have a period. This is great. But I didn't feel well and I had a lot of symptoms. And so what is the issue with going on things like that instead of regulating our hormones properly, the root cause with bioidenticals? What is the risk of doing things like that? Is that normal to not have a period when you do birth control, especially like Depo-Provera, which is the injection?
It's a great question. This generation has been an experiment, right? Because we didn't have that before this generation. And this, and using birth control pills at the high dose, now we're on lower and lower doses. So we're learning a lot through what happens over the years, because most studies only last 6 months to 2 years. So Depo-Provera long-term, what I've seen with my patients is, weight gain, hair loss, acne, difficulty resuming their cycles, and just sense of feeling icky. And some did really well with it as a good option. The same with the Implanon, the one that goes in your arm. But these are progestins, they're not bioidentical. So I divert away from them. But when that is the best option, Like, when that is the best option, you want to make sure you're doing multivitamins, antioxidants, like say, taking additional detox supplement like my Mighty Maca Plus, something that's going to have some chelators in it to help, and also taking a methylated B vitamin and magnesium, because these are things that are depleted with birth control and other hormones. So that should be part of our foundation, along with a very good diet. But especially if, I'm thinking immediately in our young adults that may not be on the best diet or lifestyle, and need something, but also need to really, if they're on a hormonal birth control, that we're supporting their body's metabolism and detoxification of those hormones. The other thing, like, of course, condoms. And I think until you're in a monogamous relationship, condoms are, mandatory. So that's what I strongly believe, especially with the study of autoimmune disease and how we worry about virus particles, right? That can be transmitted 6 feet away. So let's transmit it in biological.
Yeah, let's talk about bioidenticals too, which are more biological, which the word is biological. It's logical than the synthetics, right? So
that's a good point.
Yeah. And what I've seen the most in men and women for the functional medicine labs that we're running, which, Dutch test, GI map, sometimes hair tissue, looking at blood testing as well, and comparing the hormones between the urine as well as the blood, and then looking at how well they're doing at recycling out estrogen with beta-glucuronidase through their gut, and many other things too, like the vagibiome. So, and estrobolome. So what I'd like to talk about is people start going on bioidenticals. And I'm sure you see this a lot, Dr. Anna. So I would like to talk about the things that bother you the most when you see women who come to you and they've been put on bioidenticals, but then there's other things missing. So what is the harm or danger on taking just bioidenticals and not considering the other pieces that go with the body? Because the endocrine system is just one of 11 systems. And so there's other things that are influenced, like detoxification pathways, and like you said earlier, your brain. So what are some of the things that you see that are risk factors for just taking bioidenticals and not addressing other issues? And what other areas should be addressed when people take bioidenticals?
Yeah, this is a great question. And one of the things I always say, it's a head to toe approach. And for clients that would come to my office and they had an unhealthy lifestyle, whatever it was, I was like, bioidenticals aren't going to help you. I mean, it's not going to help you. I mean, we need to address, the big steps are the things that we have control of. 90% is in our power. And this is what I want everyone listening to understand. 90% of the positive changes that will affect us are in our power, completely free, and, and 100% natural. And what I can write on a prescription pad or do with a surgical knife, that's 10% of it. Probably even less than 10%. So, by the time it gets to the, bioidenticals, we want to have this really good understanding and communication. That's why I've written my books and created my programs, because, really by the time you get to my door where I'm fine tuning, that's what I want to be doing. I want to be fine tuning. You've covered the big things like managing insulin, super insulin sensitive with a hemoglobin A1C at 5 or lower. I want you to, be managing your stress, getting out in nature, have an alkaline diet, right? A good alkaline, make my clients check the urine pH. I want it 7 or better. And practicing behaviors that are positive in life. You're giving, kind, charitable, and, working on these things and adding in the hormones as a result of that. So managing oxytocin, cortisol, and insulin. That's the big piece of the puzzle. So when a patient would come into my office with these symptoms, whether it was perimenopausal or in the postmenopause, hot flashes, weight gain, despite not doing anything different. I've heard that so often, experienced it myself. It's a real phenomenon. I hate it. We're looking at all these other things. So I bring a patient in for these symptoms and I put them on an earlier version of my keto green plan. And when they come back in to review their lab results, they're already 90% better. in just a few weeks, and that's how quickly, now I've really honed it down to like 16 days, we can get you feeling tremendously better, right? And it's in the things that we can control. So cleaning up our diet, no white, no wheat, no sweet, very little red meat. And if you can pick it, peel it, fish and hunt it, milk it, grow it, then for the most part, you can eat it. I mean, really simple things. And adding the nutritional support. So for me, it's adding often in this perimenopause, postmenopause, bioidentical progesterone. That's one way. So like my Pure Balance PPR cream, I use progesterone and pregnenolone often together for the neuroprotective effects. And then, if we're adding that progesterone, we also want to alkalinize the body. So with greens, making a healthy keto green smoothie in the mornings or sometime during the day, and, being able to really alkalinize and detoxify, or using a supplement like Mighty Maca Plus. So these different things that can really help support your body and in hormone balancing, we see that huge transition. So, and then we're going to look at the fine tuning with bioidenticals. I typically start with progesterone and DHEA, and then add in, if we need to, testosterone and estrogen. And I think low doses go a long way. Hormones are energetic molecules. They are powerful. They can affect the way we think and behave. So keeping it in balance and being really aware, we want it to work better for us, not worse. Like, for example, high dose testosterone, anger, irritability, agitation, novelty-seeking behaviors. I mean, things like that, affairs. So that's a side effect of high dose testosterone. It's terrible to think that something that we can prescribe, that is, even though it's natural at non-physiologic doses, or in some clients, it can really change behavior. That's what's so powerful. And so we want to make sure we really are in touch and have a clear mind, so that we can discern, okay, you know what, this is off, or I need more of this, I need less of this. And that's really important, being able to discern what when you need to fine tune hormone supplementation too, when you need it.
Yeah. You're talking about this, Dr. Anna, and I support women primarily, and then a lot of their husbands or family members or personal friends in my life, or sometimes the occasional client that really needs help that is a man. And what I see right now, and it's been pretty across the board over the last year, is a lot of the men who are with the women that I support are on testosterone. And we've been seeing a lot of irritability, a lot of fights, a lot of marriage issues, a lot of cheating. There's been a lot more higher prevalence of these things. And so what I see is these high doses for men that are testosterone, and then the woman's hormones go off, and then she needs to take higher levels of them. And so I see that the thing that I ask them is, what kind of testosterone are they on? First of all, how much are they taking? Are they supporting their liver? Because in Chinese medicine and TCM, that's where we house our anger. Any unprocessed, swallowed anger that we've never dealt with from our past resides in the liver. And so if you have a hot body, if your pH is lower and you're more acidic, not 7 like you mentioned, and you have a lot of wounds from your past, maybe unprocessed trauma from previous relationships, or a stressed work life, finances. I mean, right now we're at an all-time high of stress, right? The lowest oxytocin and the highest cortisol. And so of course our sex hormones are off, but what danger is there? And I'm speaking because we are talking to women today, but supporting women would also be supporting if they're in a heterosexual marriage relationship, supporting the men that are taking testosterone, and including women who are taking testosterone. So I see this often. Take testosterone, but then very few people are actually checking to see what the estrogen levels are, or if it's metabolized properly, if it's cleared properly, if it's getting where it needs to go. So what kind of advice can you lend to people on that, men or women?
And I've run the gamut, and I've used and inserted testosterone pellets, injections, all different things, when needed, growth hormone, secretagogues, I mean, name it. This has been my field of study for over a decade and a half. So, I think it's really important to understand, like, physiology affects behavior. This is critical to understand. Physiology affects behavior. And when we're doing exogenous anything, it can affect behavior. If we are, we talk from the minutest level, from, animals that have been killed in a stressful environment, toxic environment, stressful situation, we're going to get those stress hormones. If that's all we're doing, that's affecting our body through what we eat. So let alone what we're supplementing with. And it's really important that, when we are, what goes in must come out healthfully. And I've seen this as well. And I've asked some of the largest organizations that have dealt in anti-aging, especially that were all male oriented with really high dose testosterone and growth hormone at the time. What are your divorce rates? Very, very high. Very, very high. And it is because that, and asking people and questioning people. I think of a gentleman who was CEO of a major bank, and he'd been married for 35 years. And he just, went to his doc, went to the anti-aging clinic, was put on testosterone. And at one point, his testosterone level was over 1600. Now, the sweet spot, what I found for men, is 600 to 900. You got to check in. So 1600, his doc was allowing him, because he was injecting himself more, 1600 testosterone. He's like, oh, I feel great. But you know what? He felt great. He started having an affair with his admin and divorced, and then went on a series of affairs. Like, could not keep monogamous for his life, was monogamous for 35 years in a marriage with a family he loved. And so it's really sad to see that broke down when you can look back and say in retrospect, I wonder how this was affecting my thinking. That's really powerful. And so with this knowledge and with this observation, I would tell my clients, because I would treat the woman and the man together.
Yes.
And so I was treating one of my clients from Louisiana. She fly in to see me, and she brought in her husband, who was head at like one of the heads in Monsanto or something like that. Anyway, it was great to chat. And it was, I said, okay, we're, work to help you balance, and considering especially a high stress position, let's work on this. So I started giving him low dose testosterone, but, it kind of messed up in the self injections, and was giving himself a little bit more. It was really, but I always learned to get consent, right? Consent them, and also counsel them, like, okay, if you're feeling angry, irritable, or not like yourself, thinking in ways that aren't you, you need to let me know. And so he called me out, because you know what? I'm thinking about another woman that I have no business thinking of, and I wouldn't, because I love my wife. I want to be with my wife. And I think that maybe the testosterone's too high. And sure enough, it was like 1200 or 1300, and like, oh boy. And then that's when I figured out that he was injecting a little over 1.5 times what he was supposed to be injecting. So it makes sense. And then we're like, okay, back off, stop. And then all was good. Right. But that's powerful, right? That was just stuck. That was the first time I had a guy say, you know what, I'm thinking these things, and, it's just not me. And I appreciate that. I was so glad for that.
Yes.
And that really helped me in my practice, not just for men, but for women too, because that can lower the threshold to cross some lines. And just like alcohol, right? Can lower the threshold to cross some lines you don't want to cross. We need to look at this in this way, especially testosterone.
Yeah. Is there a range on that, Dr. Anna, on how many
women?
Yeah, I would say for men and women. For men, since we're talking about men, we'll talk about that first. But, I know a lot of people are taking around 100 milligrams of injections once a week.
So what I like to do for men is a smaller dose, more frequent. So like maybe it's 10 milligrams twice a week, and let's just start with that. Or maybe it's 20 milligrams twice a week. Let's just start low and go slow, right? Because you get that initial peak and you've saturated your receptor sites, and then they want that kick again, and you got to keep going up and up. And that's when they're on, at 1600, 1700 and starting wars. So you don't want that. So, or affairs, right? And so you look at, and for women, it would typically be 5 to 10 milligrams or IUs, once a week. And then you could do it, you could go up from there, but you don't have to, versus, 50 milligrams once a month or 100 milligrams once a month. I mean, I think that's not physiologic, but you could dose it weekly. They can self-dose a small amount weekly. And I would start, I've had guys typically do really well at like, 10 milligrams twice, 2 to 3 times a week. And they don't mind. You can do it right in the sub-Q real quick. It's just a bigger needle because testosterone injections are so viscous, but so thick. So, but that's fine. They can do it sub-Q or IM. We get good results both ways. So I think that's fine, or, just that smaller dose, more frequent, and that helps with a stability. And for both men and women, it's my preference, especially in relationship. That way the male testosterone is not getting on the female, because he's getting 10 times the dosage of she needs or would want. And then looking at serum levels, I look at if you're on injections or you want to look, and again, if you're on creams or topicals, you're not going to see it in the blood. So you've got to measure it other ways. You're not going to see it as well in the blood. I mean, it's just the way our labs are. We're looking at testosterone, free testosterone with liquid chromatography, mass spectrometry. So you're not going to see, an injectable, a foreign to our body so well. So if you're doing, a topical. What you want to look at is, I think the sweet spot for men is 600 to 900. And for women, it's 60 to 90. Maybe we go up to 100. I know there are some clinics with pellets and stuff, they keep them at 200-300. And very rare, that would be the exception, not the norm. And that's just that experimental phase. We don't know, because physiologically you're not at that level for long terms in the menopause or postmenopause. Now, again, testosterone is good for our brain, our bones, our muscle, our physique, all of these good things. And you're right, it converts to estrogen. So we see male boobs in guys who are on too much testosterone and they're not converting properly. And you have to watch what we're giving. Where is it going? How is it converting? So this is where we use zinc, chrysin, saw palmetto. We use some different vitamins and minerals and nutrients to help with that conversion. So we want to keep testosterone free testosterone, and that's where we can use these additional supplements. And then also, because this is, it's really, and if we need to, especially in testosterone injections or pellets, using some medications as well, whether it's for guys, sometimes we're using in addition to testosterone, Clomid, just to keep their testes active and not to lose complete function, but to stop conversion from testosterone to estrogen. Sometimes we use some of the estrogen blockers like anastrozole. So we can do that in hormonal management as well. For women, testosterone to estrogen, that's okay, right? We like estrogen. So, but estrogen metabolism becomes really important. So this is where we want our detox pathways, wide open. And so for clients that aren't interested in supplementation, detoxification, it's like, then maybe hormones do more harm than good. But, we want to make sure that we're doing this for, in the right, balanced, natural way. And that's where these supplements and nutrients and lifestyle, big time lifestyle changes really make a powerful difference. And so I think that's really important when we're looking at serum levels of blood. But now again, looking at salivary levels, urinary levels, those are important considerations too. And again, too, for any, if your guy is on gels or creams, they do transfer. They do, and even wiping hands on a towel, they do transfer to those you love. So there are case stories of children with high testosterone levels because they hug their dad, he put it on his shoulders, and it comes off on them, things like that. So, and women too with high, I've had a client who had a high testosterone level. I'm like, are you supplementing? Is there an ovarian tumor? Is there an adrenal tumor? I'm doing this workup. He was using a testosterone gel or cream, and so she was getting it from him, and that was really fascinating to see that, how powerful that is.
So would you say that everybody who is taking testosterone should take some kind of an estrogen blocker, or is that only just based on monitoring their labs?
Based on the labs, but in general, looking at symptoms and side effects. So zinc for testosterone, I'm big on zinc to block conversion to dihydrotestosterone, because that's where you get the hair loss, male pattern hair loss, and stress increases that enzyme 5-alpha reductase. So that conversion goes like supercharged. And so that's where I had hair loss way back to here with just my natural testosterone being converted to dihydrotestosterone because of cortisol and stress. So that's a really fascinating aspect. The whole hair loss is hormonal hair loss, right? And how real that is. So I think that's a piece of it. I think that, just the keto green diet. I mean, that is my prescription, of course, obviously. That's my brand. So keto green diet is healthy because we want to eliminate sugars. We want to eliminate anything else that's going to contribute to, imbalanced hormones in general, and sugars. Absolutely. Inflammatory foods. Absolutely. Preservatives, toxins, endocrine disruptors, absolutely avoid those. Those are the big guns. And then the little bit we come in with bioidenticals and antioxidants and supplements, that's the good stuff.
Yeah. I'd like to talk to you a little bit more about too, the vagina pain. So we talk about many different things, because we only have a few minutes left here, maybe about 5 or a little bit less than 10 minutes. So we've got energy drain, weight gain, body pain, and vagina pain. And a lot of those things are directly related to hormone levels, and not just hormone levels, but what the body does when the body uses hormones, and if it's metabolizing improperly or going down the wrong pathway. This is why I love advanced testing and not just using blood testing. And you can listen to my interview with Dr. Carrie Jones. I think it was episode 3 where I interviewed her for this podcast. We talk more about urinary testing for hormones, and you can email me and then practice here if you'd like any questions answered on that. Everything else that we're talking about, like the keto greens and the keto diet, and the thing we're going to talk about next, which is a cream for your vagina, are all going to be links that you guys can follow below with special pricing for warriors only for this podcast and for the followers. So let's talk about that a little bit more. So if someone's hormones are completely in disarray, why would it be that they might be more likely to have vagina problems like pain or urinary tract infections or yeast infections or anything down there that feels like it's inflammatory and just not very fun down there, as women like to say?
I know. Yes, I tell you. And let me tell you, clitoris to anus, that is our most valuable real estate in our body. That is important to take care of that better than we take care of our wrinkles, all this stuff. We need to take care of our vulvar area, clitoris to anus. I mean, it really does affect us long-term, affects our quality of life. And that's what's really important. So I would say that, as we're getting older and our hormones are shifting, the vaginal pH is also becoming more alkaline. Now, normally the vaginal pH is acidic. Why? Because we don't want microbes going into our vagina, going into our cervix, going into our uterus. Acidity is a defense mechanism, right? Acidity in our stomach, break it down, kill the parasites. Acidity in our skin, break it down, kill the parasites. Same with the vagina. So the vaginal pH is typically acidic. Now, as we get older, the pH increases, becoming more alkaline. And so that's where we often see some bacterial vaginosis infections, the fishy odor, irritation, sometimes a grayish discharge. You can see things like that. At the same time, as we're getting older, we have decrease in natural mucosa, and not just age, right? Endocrine disruptors, parabens, synthetics, toxins in our food and water and drink, all these things, or beauty products, all of these things affect our hormones. So vaginally, we can get dryness, thinning of the mucosa, and that naturally happens as we age. But I'm seeing it actually, vaginal dryness, as an issue in younger women, 30s, in their mid 30s even, or if they're on birth control pills or on an IUD. Those are some things that, can really affect our hormones. So when we have this dryness going on, we have, that allows pain, discomfort, even discharge after sex. So I always tell clients, if you have pain every time you do something, why would you want to do it? Right? Like if you were a baseball player and you went up to bat and every time you got up, you got hit by the ball, like you would not want to play baseball. So the same with women. And so that pain, that discomfort can be from dryness, irritation, the loss of elasticity, the loss of lubrication. And so all of these things are affected. And that is part of natural aging, but that is where we want to intervene and reverse that process, because incontinence, relaxation of the muscle around the urethral sphincter where we pee from. That creates incontinence. The vaginal walls relax, and that creates prolapse, and either anterior prolapse or posterior. We call that cystocele and rectocele. The uterus can sag into the vagina. You can feel this pressure. I know it just sounds terrible. I'm like, we have to exercise the vagina, use jade eggs, do your Kegels, use Jolva, my other product I created, just because like I needed something natural for me, right? Let's put our use bioidentical hormones in that area to just help reverse these changes, because we don't want to suffer. And this is another area that becomes a silent distress between couples. You're in your 40s, decreasing comfort or decreasing orgasm or dryness, having pain with intercourse, or urinary tract infections with intercourse, or after intercourse, vaginal discharge. I mean, why would you want to have sex, right? So there's this silent divide. Number one, you're like, and this is all subconscious, like, okay, something that causes me pain, my body's not going to go for it. And he thinks, because his number one is that you have pleasure. Well, she's, I can tell she's not comfortable, or, whatever it may be, as women power through. And that's been something, the words they've used with me before. I just power through it. Well, that's not what he wants either. So then he stops initiating more and more. So you have this divide. And then once you can reconnect, that's amazing. I had a client call me earlier, Diane. She is 56 years old. She was divorced 20 years ago and raised her children. They went off to college. And she finally said, okay, I'm going to start dating again. And she called me up. She goes, I met the man. I feel like I want to spend the rest of my life with him. Let me tell you, Dr. Anna, now I'm on my third urinary tract infection. I went to the doctor, and she said that I needed to be on an antibiotic every day, just take an antibiotic every day. And she goes, I just don't feel that's right. So I wanted to get your opinion, since you're my girlfriend doctor, she said. And I said, okay, well, and she said, I've had a discharge and the urinary tract infection. I said, well, you know what we call that? And her name is Nina. I said, you know what we call that, Nina? And she goes, no, what? And we call that honeymoonitis. So first of all, because the urethra is a little bit more relaxed, and bacteria will get inserted into the bladder, and that can cause that urinary tract infection, especially when you don't have that good tone of the sphincter and the good mucosa to keep bacteria and acid pH to keep bacteria count down. So what happened is, I told her, okay, take this probiotic, take higher dose vitamin C, 2,000 to 4,000 international units per day, and take, I used Jolva. So I had her go from using Jolva once a day to twice a day, and pee after sex. And she's like, that just was game changing. That was game changing. Now they're engaged to be married. And so it's so exciting, right? And she told me this the other day. I had a follow-up call with her. She goes, Dr. Anna, I can see how this could have been very, very different. Our intimacy is so supercharged. We love being together. We love everything. But when I was having those urinary tract infections, the discharge, and it hurt was having sex, like that, like I didn't want that. I was more distant. So I just think, and that's so true. And that happens silently because we don't talk about it. Mm-hmm. And we need to talk about it. We need to address this issue. We need to heal. So probiotics, omega-3s, healthy fats, keto green diet, avoid sugar, use vaginal probiotic if you need to, and use Jolva once or twice a day if you need to. So those are things that can help. And if you need additional support, have your doctor prescribe you vaginal testosterone. Or vaginal DHEA. Those are available by prescription. So, there's something we can do about it. And this is valuable real estate. The number one reason caregivers put their loved one into a nursing home, Diane?
What?
Incontinence.
Oh,
incontinence.
Really?
Yes. It's the straw that breaks the camel's back, so to speak.
I don't like how camels have to have their backs broken. I rode 3 of them when I was in Egypt, and I'm like, I don't want to break anybody's back.
And they are stoic. I don't think I've ever seen a camel with a broken back, but he's got to take a pretty heavy burden.
Too. I was like, oh, this thing
I can see you doing that. Oh my gosh.
On the pyramids. Yeah, I did.
Did you post any pictures?
There was a picture of the 3 pyramids of Giza, and we were the only tourists there because COVID. And I was surfing on the camel, and I didn't break his back. So
No, you
I
did.
wasn't the straw,
Awesome.
but as you were saying,
You
the
were
straw
not
that
the
broke the
straw.
camel's back.
Right. Yeah. So that's pretty powerful, and it's a really big issue. And you can see it
Yeah.
now. It's a growing issue because I think because of pads, panty liners, all the chemicals in them
And
create increased
tampons when they were
weakening.
younger.
And
Yeah.
even tampon trauma as we're older and we're breakthrough
Yeah.
bleeding and we have decreased vaginal mucosa and our moisture and our mucosa is thinning. These are
Mm.
all setups for problems and the
God.
chemicals.
And I was a financial planner for 8 years before I became a functional diagnostic nutrition practitioner and holistic health coach. And I sold long-term care policies to all of my clients that were over 50 because it makes sense to have something like that because it's so expensive to put someone in a nursing home. It's like $80,000 a year
Yeah.
for a decent one. And if the number one reason they're going in there is for incontinence, don't you think it's pretty important to take care of your vagina
Yes,
and your prostate? I
absolutely.
mean, these hormones are so important, and it could save you not only your quality of life and your life, but also a lot of money because it's very expensive to put them in there. $80,000 a year. So imagine if you're just listening to Dr.
Whew.
Anna, yeah, multiplied by like 4 or 5, because that's the average person goes in there for 4 or 5 years. So it's like $500,000. If you can save these parts, you're going to save the wealth of these elders, and then also what get passed down from generation to generation. It's not just about health. It's also about quality of life.
Quality of life. It is quality of life. And it's so important. It starts now, whatever age you are, never too early, never too old.
Yeah. Okay. You guys, we didn't have time to talk about, I mean, I could do 7 days with this woman, obviously, your girlfriend's doctor. We didn't talk about, I know you guys are really excited about talking about weight gain and how to reverse it and to gain more energy in the meantime. So what I'm going to do is I'm going to put, like I said, all the links below for Anna's keto greens diet, her Mighty Maca, which I love, Mighty Maca Plus, the Julva cream. She's a woman full of resources for all of us. So I'm going to put all those links below. Dr. Anna, one final thing would you like to share about the weight gain aspect? Because you talked about keto, you talked about, some things where we can gain weight and how to lose it easily. Just maybe a statement or two on some of the things that you have shared and what you offer in your programs to help people that have weight issues.
Yeah, definitely. Like my keto green plan, it's about, healthy fat, high quality protein and greens, the greens that help detoxify estrogens in the right way, like our cruciferous greens and low carbohydrate greens and vegetables, antioxidants, herbs and spices. So my Keto Green 16 book is really a great resource for everyone who wants to gain control of their weight, right? And let me tell you, it is, it's a non-ending challenge in times of stress. So I get that. So Keto Green 16 incorporates also, it's not just about what we eat, 16 hours of intermittent fasting, no more snacking, and scientifically combine these foods to keep your blood sugar really, really stable. So it's a very balanced approach. And when you do that, when you avoid sugar, you break up with sugar, that bad boyfriend, that toxic boyfriend that always wants to squeeze right back into your life, you do a lot of good for your body. And that is huge right now. So doing those 3 things, getting keto green, intermittent fasting, and breaking up with sugar is essential next right steps.
Divorcing the demons that cause you
Yes.
disease, and sugar being a huge one. I'm currently fasting on a 16-hour fast, and I just did my keto greens this morning. So Anna, thank you so much for being here today. Thank you so much for suffering so that you can share with us how not to do it. And thank you for all these amazing products that you put out there and your book. I know how hard it is to write a book because I just wrote one of my own on breast implant illness.
Yes. So good.
Yeah, we didn't have time to talk anything about that either because breast implants do obviously affect your hormones and toxic levels in the body, but that's for another show. So if you guys have any questions or follow up, be sure to go to dianekaiser.com/ask. And also please make sure that you rate, review the podcast, and also just give Dr. Anna Cabeca a little bit of love because this was an amazing podcast. And these are a lot of things that I can't do on my own because she is an OBGYN and your girlfriend doctor. So maybe we'll have you back on another show, but in the meantime, go to check out all her links and all her products and her book. Thanks again, Anna. We'll see you in the next episode.
Thank you.
Thanks for tuning in to today's show. If this episode really tugged at your soul and you're ready to have your personal breakthrough, we would love to have a heart-to-heart with you to get you crystal clear on 3 things. What do you want? What's standing in your way? And how do we get you to your soul goal in the fastest time possible? Visit my site, dianekaiser.com/call to schedule your free 1-hour connection session with one of our warriors to map out exactly how you want to look, feel, and live. We've helped thousands of women warriors just like you all around the world free themselves from the symptoms and suffering they never thought possible. And you just might be our next success story. Talk soon.